Please start, madam. Please start, madam. Please start.
Good evening, everyone. I'm Dr. Scienthia Sanjivani, consultant nephrologist in Utkal Hospital, Bhubaneswar. On this great platform, I will be discussing regarding one main dialysis modality, that is peritoneal dialysis, and it is a very good treatment option for CKD patients, and I think everyone should know about it. So I'll be explaining under these outline headings a brief about the kidney functions, treatment options after the patient is told about the kidney failure, and peritoneal dialysis as an option in renal replacement therapy. Overview on peritoneal dialysis, benefit regarding the same, and risk, complications, and management of the same. So, what and where are our kidneys? These are small bean-shaped organs which are located either side of the backbone in the body cavity at the level of the waist. It's about the size of a fist. Length is around 10 to 13 centimeters. Weight around 130 to 160 grams. So, how do they work? The function of the kidney, the major function is to remove the waste products. So our blood containing all the waste products from the metabolism of the body goes inside the kidney, it gets filtered, and the waste gets removed through the urine. And the clean blood goes back to the body. So kidney's main job is to remove the waste products. It helps controlling the excess water from the body, and it keeps electrolyte balance, keeps our bones healthy, controls our blood pressure, and makes red blood cells to maintain the hemoglobin. So why kidneys fail? So long-standing poorly controlled diabetes is one of the major causes, and long-standing hypertension. Some drugs also affect the kidneys. Inflammation of the kidney tissue, infections. Some patients are born with abnormal kidneys, hereditary conditions, and often the cause of renal failure is not known. So, what are the renal replacement options being given to the kidney patients once they are told that okay, their kidney functions are no longer appropriate and they need a renal replacement therapy? So, we usually advise the patient about the three options. First and foremost, renal transplant. They can go for the renal transplant. Second is hemodialysis, which is a blood dialysis. And third one is peritoneal dialysis. So, peritoneal dialysis or hemodialysis is first choice of renal replacement therapy. Before counseling the patient, we have to take into account many factors. So, benefits of peritoneal dialysis when kept as the first choice are: there have been studies that where it is seen that patient survival is better in peritoneal dialysis. Preservation of residual renal function can be there if some amount of urine is still there in the patient, so it can be preserved with peritoneal dialysis. Since it is bloodless dialysis, protects this protection from the transmission of viruses which can be transmitted through blood. It preserves the vascular access for future. Like if the patient has cannot have a fistula for the hemodialysis or sperm cat or temporary dialysis catheter, this is a good option. If the patient is being planned for renal replacement, renal transplantation, so it can be given as a bridge therapy. Quality of life is considered better in home-based dialysis because the whole technique and the whole procedure is in the hands of family members, caretakers, which are obviously more careful if trained well. So there are few strong medical indications for peritoneal dialysis, like difficulties in the vascular access is already discussed. You cannot make the AV fistula or the line, jugular catheters cannot be put. Severe left ventricular hypertrophy. Major hemodynamic changes are less in peritoneal dialysis. Congestive heart failure, same reason. Coronary artery disease, valvular heart disease, prosthetic valve. So these are few of the indications in which case we prefer peritoneal dialysis. Patient having intolerance of hemodialysis, like frequent episodes of hypotension are there, risk of severe arrhythmia during dialysis, hemodialysis, headache and asthenia after hemodialysis sessions, and children also. These are the medical indications for peritoneal dialysis. So we'll give an overview. What is peritoneal dialysis? So it actually uses a filter to clean the blood and remove the excess fluid. In peritoneal dialysis, the blood is cleansed inside the body using one of the body's own membranes, which is peritoneum, as a filter. So it is a home-based therapy, so you can fit your treatment around your lifestyle. So how does it work? As already told, it uses your own peritoneal membrane in the abdomen. That is the lining of your abdomen as a filter. A special solution is placed in the abdomen in contact with the peritoneal membrane for several hours. As you can see in the picture, that there is a fluid going inside the abdomen, which is kept inside and which helps the removal of the waste and the extra water through that fluid, and that later on that fluid is drained from the body, and eventually we have a less of toxins and fluid. So peritoneal dialysis catheter implantation. So it is usually performed by a competent surgeon or a nephrologist. Um, a tube called catheter is surgically placed through the wall of the abdomen. So as depicted in the picture, it is usually placed an inch below and the side of the navel. About 2 to 4 inches of the catheter extends out of the body, and we can, after the insertion, we can usually start the dialysis 10 to 14 days after the procedure. So post-operative care, immediate post-operative care, patient is told to have absolute bed rest for 24 hours, and he can have limited mobilization for 24 to 48 hours and full ambulation after that. Then the procedure starts by PD nurses under doctor supervision. So there are two kinds of peritoneal dialysis. One is machine-based, that is automated method of peritoneal dialysis, and is performed by a machine while the patient is sleeping. So second is continuous ambulatory peritoneal dialysis, that is CAPD, which is usually performed and that is done manually by the patient or the caretaker. So how do we prepare the patient for peritoneal dialysis? There is a pre-dialysis counseling which needs to be done, and peritoneal dialysis equipment and accessories to be arranged. Peritoneal catheter insertion is done. Then there is a break-in period where it is the peritoneal dialysis is started and the dialysis procedure is started. So pre-dialysis counseling, here motivation, compliance, and home environment are the important factors for the success of the therapy. As PD is home-based self-treatment, so patient has to be very much motivated and the compliance needs to be checked. The better understanding of the kidney problem and the dialysis therapy, the better the motivation and the compliance. This counseling can be done by nephrologist, dialysis counselor, or the therapy, PD therapy specialist. Then there comes the break-in period. What is break-in period? Uh, Break-in period is a sufficient time to heal the surgical wound, that is the exit site through which the peritoneal dialysis catheter is inserted. It usually is 2 to 4 weeks. Aseptic dressing with minimum opening is recommended. Immobilization is very much important. And temporary HG should be considered in this period in patients with advanced kidney failure in whom the dialysis is on urgent basis. Some centers start PD training early also based on the patient's condition. So here you can see this patient comfortably sitting on his sofa, getting the peritoneal dialysis done, reading newspaper. So it depends on the comfortable procedure. So what are the peritoneal dialysis components? You need some fluid bags which contains the special fluid we talked about. There are small blue clamps which control the flow of the fluid in the abdominal cavity. There are mini caps which prevents the germ entry to the inside the catheter, and there is a transfer. So, what is this exchange procedure mean? So in this procedure, what we do is the special fluid known as PD fluid present in the peritoneum is drained and fresh solution is filled in order to perform the dialysis. So as you can see in the picture that there is a fluid in the peritoneal cavity which is drained and then the fresh fluid is infused. So they are basically in the simplest way, there are three steps. You fill, there's a fill phase where you fill in the special fluid in the abdominal cavity. Then there's a dwell phase, then where the fluid is inside the abdominal cavity and the waste products and excess fluid is getting into the fluid to be removed later on. That is known as the dwell phase. Patient can move around, play around, whatever he wants to do during that dwell phase. Then there is a drain period where the extra fluid after the dialysis is done is drained from the body. So the question, where can I do my bag exchange? Anywhere, but certain steps must be taken to make sure you can carry out it safely. It should be a clean room, it should be a well lit room, and there should be no interruption. It should have a workspace that can stand up cleaning with antiseptic solution. It should have a sink nearby or inside the room. And when can I do the procedure? Usually, your doctor will suggest that it is done in 3 to 4 exchanges. So the 4 exchanges time is around in the morning, then in the noon, evening, and night. So after that, regular blood investigations needs to be done to monitor the levels, and regular dietary restrictions need to be taken care. So the exchange procedure has certain steps. We have to prepare, we have to connect, we have to drain. Then there's a step called flush, which we'll talk about in some time. There's a fill phase and then disconnection and cap off. So now preparation of the room. Door should be closed, windows should be closed. You should need to switch off the fan. The patient and the caretaker should be wearing a mask, make sure the nose is covered, perform simple hand wash using the proper hand wash technique, dry your hands, clean the work surface with the spirit gauze, and place the necessary materials which are needed on the table. So you need to check your solution bag, that is a PD fluid. It should have one pull ring, which is needed to hold it. You should check the concentration of the bag, which are in various forms as per the prescribed by the nephrologist. You need to check the quantity, you need to check the expiry date and the leakage. You need to tear the outer pouch of the bag without touching the inner content. um, Open the closed pouch containing the catheter and attached to the patient. Then again perform a 6 step hand wash technique. See, at every step, all we are emphasizing is the sterile way. So how do you connect it? So after drying your hands thoroughly with a sterile towel, do not hand dry your hands in air. You pick the bag without touching the outer pouch, which is not sterile. So check the clarity of the bag. It should be a clear fluid. And then you suspend the bag on an IV stand. Then you place another sterile towel under the catheter attached to the patient. Then again use sterilium on your hands. unroll the tubing on the bag and place the drain bag on the newspaper sheet or in a bin or tray on the floor. So what next needs to be done? You have a blue clamp which needs to be placed on the fill line. Then there is a green frangible which you need to break, and then remove the pull ring downward. So this all are connected to the bag. So you need to remove the mini cap and then you connect both the ends and immediately connect wires to the transfer set which is attached to the patient's catheter. So how to drain it? So there's a twist clamp which needs to be opened to drain, and then you check the drain, and then close the twist clamp after the draining is complete. For how long patient should wait for the drain? If the drain flow is slow, then you can change the position and check the line to monitor the flow. When it is too slow, like in drops, then you need to take the above precautions. So now there is a step known as flush. You flush, you open the clamp on the fill line. Uh, Remember, we have a bag hanging over the IV thread. So we connected a blue colored clamp over the fill line on the bag. So you open that clamp, you count slowly from 1001 to 1005 to flush. Now clamp the drain line and do not hurry. So then you open the twist clamp to fill. So the PD fluid hanging over the IV set will go inside the abdomen. So it usually takes around 10 minutes and then you close the twist clamp after the infusion is complete. Now clasp the fill bag and open the mini cap to connect and use again the sterilium. Every time you are touching the catheter and the transfer set, you will use sterilize your hand. So then you disconnect the set and now the fluid is inside the abdomen. We have done the drainage, we have done the flushing, we have filled the abdomen with the PD fluid. Now what we'll do? We have disconnected it, we have put in a mini cap. Now we'll check for the wetness around the catheter. We'll check for the exit site leak, if there's any leakage through the catheter. So now we'll cap off with the transfer set pointing downwards, and now uh, the fluid which we have drained, which is kept over a newspaper, now we'll check for the drained fluid. So we have kept it over a newspaper for a reason that we need to check the clarity of the fluid. See if you can read the fine print. Means that the fluid is clear. So now you'll check the weight of the fluid which is removed. It will give us an idea how much extra water has been removed through the fluid. Now we'll keep a record how much what how many exchanges we have done, how much is excess of water through the fluid has been removed, how much is the weight of the patient, what are the blood pressure readings. All these recordings have to be done and shown to your nephrologist. Then you drain after the recording is done, you drain the fluid in the toilet. What are the certain precautions? Just to brief around, there should be a proper place, hand washing needs to be done, mask to be worn, aseptic environment should be is a must. There should be a proper water supply, drying of hands needs to be done, correction fast and safe to be done. So having said all that, learned about the procedure, precautions and everything, Every procedure has some complications. Needless to say, peritoneal dialysis also has some. And peritoneal dialysis has been stigmatized that it is equivalent to infection. Of course it is, but infection is there in hemodialysis patient also. Transplant patients are also at risk of infection. So with few precautions at every step of the procedure, we can reduce the infection risk. So, first and foremost, complication is infection if it is not done properly. So, as already explained, that it can occur in hemodialysis and transplant patients too. The in CAPD, the infection is usually confined to the peritoneum, that is the abdominal wall we talked about. Whereas in hemodialysis, the infection may spread to the blood, which is more serious. Transplant patients are also highly susceptible, hence they are advised to take immunosuppressant drugs throughout their life. Infection can occur during exchange period if adequate precautions are not taken. So, few things which needs to be taken care of are prolonged constipation needs to be avoided. So, any concomitant infection of the abdomen like diverticulitis, constipation, urinary tract infection, lung infection can reach the peritoneum and in return cause peritonitis. Any invasive procedure like dental procedure or endoscopic procedure without antibiotic coverage will obviously predispose you to the infection. So infectious causes we have already discussed. There are few non-infectious causes like your the fluid flow will reduce, which is called outflow failure. Constipation is one of the major causes. That's why we advise the patient to avoid it. There is a pericatheter leak, that is fluid being leaked through the exit side. That can be membrane failure. The patient has insufficient flow across the peritoneal membrane, so inadequate dialysis might be there. Catheter can come out through the skin, or sometimes, very rarely, there can be the cat through the catheter. It can go into the the intestine. So these are rare complications. So coming back to the peritoneal dialysis benefit, factors which favor peritoneal dialysis by way of quality of PD is, of course, a traumatic procedure. Like in hemodialysis, you always need needles to be inserted before the hemodialysis. PD does not involve any needling. So PD is a more physiological therapy than hemodialysis, as it stimulates the natural working of the original kidney. Patient benefit in the way that they can have more flexible holidays, lifestyles, travel, and higher employment rates. Independence, mostly you perform your therapy yourself, so you can do it, adjust it as per your own time. Lesser visits to the hospital and lesser hospital acquired infection. A more liberal dietary habit where under constant supervision by nephrologists and under renal dietitian. So to conclude our talk, advantages of peritoneal dialysis is you can manage your own care at home, greater independence and control, flexible treatment schedule, less restricted diet, no needles required, less stress on the body. Blood pressure control is more there, lower cost of the treatment is there. Few disadvantages, obviously, that you need to do the dialysis 3 to 4 times a day. Permanent catheter is being put in the body. Body image changes are there, especially in the young patients. Risk of infection, if not done properly, to be emphasized. Possible weight gain can be there if the flow is not managed properly, and storage space for all the supplies and the fluids needs to be taken care of. So that's all about the peritoneal dialysis. Thank you.